hypertension, and it has some role in patients with progression of obstructive sleep apnea, diabetes, heart failure, and other metabolic diseases. So initially, when it was introduced, it was initially used to treat resistant hypertension only, and now the role of renal denervation is beyond hypertension, and it is useful in some patients with chronic heart failure also. So, what is the need for the new treatment option with hypertension? Because of uncontrolled hypertension, now in spite of all line of medications, in spite of two, three, four different type of medications, sometimes we are not able to achieve the blood pressure, adequate blood pressure control. In these patients, it is beneficial. Or is if there is a poor adherence to the lifestyle recommendations and antihypertensive medicines which we usually prescribe and tell the patients to follow, if they are not able to follow the lifestyle recommendation and antihypertensive medicines, these are the patients who benefit with renal denervation. Despite diagnosis and treatment, effective control of blood pressure is low. If we do 24 hours ambulatory BP monitoring, we found that the blood pressure control over 24 hours is not adequate, and which we can achieve with renal denervation. So the role of non-adherence, lifestyle changes and medications usually we prescribe to the patients, but sometimes it's underappreciated because hypertension many of the time is without any symptoms. So many of the patients, they think that what's the need of medication, they stop in between, or they don't take it properly, they won't follow the lifestyle this one changes which we tell them to follow. The definition and terminology, definitions wise, there is no proper definition when to send the patient for renal denervation. Usually, if 2 to 3 medicines, if more than 3 medicines, we are not able to control the blood pressure, then we recommend the patient for renal denervation. It has its limitation for direct and indirect assessment also, and sometimes it is overestimated in clinical trials also. What are the factors which are for non-adherence of medicines and lifestyle changes? There are some socioeconomic factors for non-adherence, patient-related if they are not taking proper medication, therapy-related if the medicine is not adequate, some condition-related or health system-related. These are the many factors for the non-adherence of medicines for the blood pressure. From hypertension to heart failure. Heart failure also is a chronic condition with a poor adherence to therapy. Hypertension and heart failure frequently coexist, and incidence of hypertension, heart failure in the patients of hypertension is twice in men and 3 times in women. So hypertension gradually causing electrical hypertrophy, which deteriorates the systolic and diastolic function over a period of time, which can cause heart failure with either the preserved ejection fraction or heart failure with reduced ejection fraction. So hypertension, if it is not controlled properly, it can progress and worsen the heart towards heart failure. So from changes in what exactly happened in the hypertension, changes in the afterload can be resistant or pulsatile. Pressure overload, afterload diastolic dysfunction which can progress to LVH and then progress to heart failure with preserved ejection fraction. If there is eccentric hypertrophy which leads to heart failure with reduced ejection fraction. So, what is the rationale behind renal denervation for hypertension and heart failure? What exactly renal denervation targets the sympathetic nervous system activity. So, it targets the sympathetic nervous activity, so reduces the sympathetic nervous system and reduces and it mainly affects this renin angiotensin aldosterone system. So, reduces the renin release and it helps in controlling the blood pressure. So what exactly happens when there is a sympathetic nervous system activity? It increases the blood pressure by causing peripheral vasoconstriction. Fluid retention, release of renin is increased, which further causes sodium and water reabsorption and causes over a long period of time chronic cardiorenal damage. Renal damage by doing globular hypertrophy, or it can cause tubular interstitial fibrosis. And in the heart, it causes myocardial hypertrophy and myocardial fibrosis with cardiac remodeling happens due to sympathetic nervous system activity. So, sympathetic nerve fibers which usually originate in the abdominal ganglia and accompany the renal arteries. So, there are renal afferent sympathetic pathways which are originating from renal artery and renal efferent pathways also. So this is the diagram. This is the renal abdomen. This is the renal artery, and having its own. After distally it's going. It's having its two branches over here. So this is the proximal segment, mid segment, and distal, and these are the branches. So these are the fibers. This is the percentage of sympathetic nerve fibers which is written. So proximally it's around 29%, then coming to the mid is 55%, then 63%, and over the distal part it's having the maximum of around 68%. So distally, the more distally you go in the renal artery, the more the sympathetic fibers will be there in the renal artery. So what exactly do sympathetic nerve denervation, renal denervation, what exactly happens? The afferent and efferent sympathetic pathways are affected. So there is a reduction of global sympathetic nervous system activity, which increases the LV function and reducing the fibrosis, increases the renal blood flow, causes decrease in the glomerular sclerosis, decrease in renal release, sodium and water retention is decreased, natriuretic peptide level increases, angiotensin 1 and 2 levels also reduces. So this will cause fall in the blood pressure and increase in the vascular reactivity. So this what exactly happen if we do sympathetic denervation in patients with persistent hypertension. So renal denervation, what exactly happen? Reduce in the renal catecholamine levels. It inhibits the RAS pathway, increases the BMP levels, inhibit the nephrolysis activity, decreases vasodilation, increases diuretics, which reduces the myocardial stress and further reduces the myocardial fibrosis. So this is the trial. There are different trials over a period of 3 months, 6 months, in which they did renal denervation, and what they have found, there is a good control in the blood pressure. They did a 24 hours ambulatory BP monitoring. The systolic blood pressure is reduced in all the trials, as well as the office systolic blood pressure is also reduced with renal denervation. So these different trials have shown all the positive results after renal denervation. So initially there was surgical option also available, surgical sympathectomy, which was in 1940s. It started with for treatment of severe hypertension. At that time there was no much of medications also available. So, but it was having its own severe side effects. So it was initially introduced, and nowadays it's not used. also, which paralyzes the sympathetic nervous system. So these are the different catheter-based techniques with the radio frequency. This is the Medtronic catheter, which is introduced into the renal artery, and it gives multi electrodes. This one radio ablation, and they have found the very good result, and it is recommended in patients with uncontrolled hypertension. These are the three different catheters available for radio frequency ablation. And this is a second, which I told you, this is ultrasonic waves, which also causes this renal denervation. And there is this neurolytic agents like peripheral, which also which comes with the three extension of microneedles, and it causes sympathetic denervation. So these are the different catheter system for renal denervation: radio frequency, ultrasound, and neurolytic agents. So catheter-based renal denervation for hypertension, it is a safe procedure. Vascular complications are very less, with hardly 0.5%. 24 hours BP reduction. We have found all different trials, and that it is really beneficial. And European guidelines now they have recommended this renal denervation. Initially, in 2023 and 24, they have recommended for renal denervation in patients with
24 hour BP reduction એટલે 24 hour પછી થશે કે 24 hour control મળશે? What is the meaning?
The meaning is 24 hour
Control મળશે.
Sorry. So what exactly is the renal denervation in hypertension and chronic rational is basically reduce afferent sympathetic tone and renal sympathetic denervation. In chronic hypertension, it's having its own proven safety and blood pressure lowering efficacy. Guidelines, it is nowadays recommended in European guidelines. For heart failure, there are no such guidelines at present. So probably in future it will come. So renal denervation to lower the blood pressure, this is the 2023 guidelines, where it can be considered if the drug treatment elicits serious side effects or poor quality of life. And if it is a resistant hypertension, it can be considered. In 2024 European Society guidelines, it is for the plain hypertension, it is considered with the cardiovascular risk is increased, but is not recommended as the first line intervention. So, and in resistant hypertension, it may be considered. So, class 2B guidelines. So, what exactly we need? So, we need a multidisciplinary hypertension team, experienced specialized centers, and it is recommended in patients with eGFR more than 40 ml per minute. So, renal denervation in heart failure, how exactly it helps? It controls the blood pressure, it helps in symptomatic improvement, it helps in cardiac remodeling, and they have done a 6-minute walk test also, which is also found to be beneficial after doing renal denervation in patients with heart failure. So these are the different trials which they have done in patients with heart failure with reduced ejection fraction with less than 35-40, and but no trial has shown clear much more benefit with renal denervation, because in heart failure there are multiple modes of treatments are required, like medicines and other factors also. Probably in future we need more trial which shows clear benefit of renal denervation in heart failure. So future directions, it lacks intra-procedural measure of success. We only after measuring the blood pressure response after doing 24-hour ambulatory BP monitoring, then only we can know how exactly how much we got the control of blood pressure in patients with resistant hypertension. And there is sympathetic nerve fibers are as in renal artery, it is present more in hepatic liver also. So hepatic denervation can be considered in future. to the